Hello, I'm Brandon. I'm a student nurse over at Oakland Community College, and I'm going to be performing a full head-to-toe assessment on your newborn baby today. Before we get started, I'm going to do some hand hygiene, and get some gloves on as well, and I'm going to confirm or compare the wristbands between the mother and the baby. So after I do that, perfect. Now we can get started. So we're going to check the baby first. And one thing we want to note is we want to keep the baby warm. So we can do that. If we do have a radiant warmer available, we can use that during the assessment. If not, then we just want to make sure that we keep them covered as much as possible during the assessment. So let's get started. First thing we want to do is our vital signs. So we're going to check apical pulse, and we use our stethoscope and then the bell of the stethoscope. And we do it for a full minute. So the pulse rate should be between 110 and 160 beats per minute. If they're sleeping, it should be around 100. If they're really active and crying, it can get all the way up to 180. While we are already here, we can count respirations. So we can either listen to the respirations or we can watch their body move up and down as they breathe. So we listen for a full minute here as well. So as we're checking respirations, it is normal for there to be irregular breathing or pauses within the breathing, which can last about 5 seconds. If it is lasting any more than that, then we definitely want to notify the provider. But the respiration rate should be between 30 and 60 breaths per minute. We're looking at the baby here too. We want to note for signs of respiratory distress. So that can be circumoral cyanosis, which is bluing of the lips. That could also be grunting, which is rhythmic. Grunting here and there, is normal, but when it's rhythmic or sounds like singing, that is a bad sign, as well as any retractions of the muscles. If it's like seesaw breathing or they're really using a lot of their abdomen muscles to take in breaths, that's another sign. And then finally, nasal flaring as they're breathing is another sign. We will also want to check for lung sounds as well, and we check bilaterally. So we want to make sure that they are clear on both sides. And now we're also going to do the axillary temperature. So we use our probe, and we're going to insert it underneath the baby's armpit, and then we hold the probe and the arm over the probe. And when we look at the temperature in Celsius, it should be 36.5 to 37.5, and if we're measuring Fahrenheit, it'll be 97.7 to 99.5. Now that we have done our vital signs, we can do our overall assessment of the baby. So we're going to check first for overall appearance and their posture and movement. So the baby should be relaxed and in a flexed position. Shouldn't be too flaccid, shouldn't be super flexed. And we're also going to be looking at the overall spontaneous movement as well. And then we're looking at the baby's skin. Should be pink or appropriate for their ethnicity. And it should also, there should be no signs of jaundice, although it does happen here and there. Should be happening after the first 24 hours though. Should not be occurring within the first 24 hours. So to check that, we always will do a blanching test upon our assessment. So we can blanch the nose, the chin, and the chest. It should be coming out white. If it's coming out yellow, then that is a sign of jaundice. We're also checking for any signs of cyanosis. A normal sign would be acrocyanosis, which is bluing of the hands and feet, which will go away within the first 24 hours. Now, we're going to perform the head to toe. So we're looking at the head first. We're checking the anterior and posterior fontanelles. So they should be soft, flat, and open. They should not be sunken. We are looking at both of those, and then we're also checking for any soft spots on the head. So this could be between the suture lines, so any kind of swelling like that. Between the suture lines is cephalohematoma, which is a pooling of blood between the skull and the periosteum. Or if it does cross suture lines, then this is actually caput succedaneum which is usually happens after childbirth, where it looks like a cone head. That's just like excess fluid that built up, which both of those should go away on their own. Now, as we look down, we're going to assess the clavicles. So they should be intact. There should be no signs of crepitus, which is that crackling or crunching that you feel, or any lumps. And they should be nice and hard and intact. As you go down, you're going to be looking at the abdomen. So I'm just going to go ahead and take off the diaper now so we can properly assess the bowel sounds. They should be clear. Sorry, not clear. There should be bowel sounds in all 4 quadrants, so we're going to check that. Auscultate first, and then we're always going to check the umbilical cord. So the umbilical cord should be dry and intact. There shouldn't be any signs of infection, such as redness, drainage, or foul odor. And then we're also going to look at the, before that, when we do put the diaper on, we always fold the diaper underneath the umbilical cord to prevent any irritation and to keep the umbilical cord dry as well. Now we're going to look at the back of the baby. So what we're looking for is assessing just all the spots, like, if they have Mongolian spots or stork bites or anything like that, we're checking that out. Then we're also checking for the pilonidal dimple. So a lot of times the babies don't have it. Sometimes they do. There should be skin covering over it. If not, then we're also checking for any discoloration, any tuft of hair, anything like that. This could be a sign of something more severe. In rare cases, could be spina bifida, which is when the spine doesn't fuse correctly during development to the rest of the body, which can cause weakness later on. After that, we are checking the genitalia. So in females, the labia majora is going to be covering the labia minora. There may be signs of some kind of like mucoid, like white mucoid. That's completely normal. The vaginal area may be swelling as well, which is normally just due to the mother's hormones passing on to the baby. All that's completely normal. For males, we are looking at the urethral placement. So this should be midline. It should not be epispadias or hypospadias above the midline or below. And we're also checking that the testes dropped as well. So you palpate onto the pelvis, and then you grab the testes but with your 2 fingers, and you're looking for that little P inside on both sides. And then from that point, we're going to get the diaper back on. Like I said, below the umbilical cord. And then we're going to be checking all of our reflexes. So the first one I like to check is the Moro reflex. So that is when you pull up the baby's hands and then let go. They're going to sprawl out their hands and then kind of shake like this, almost like they feel like they're falling. And we also check for grasping. So we grab the baby's hands. They're going to clench their hands over our fingers. There should be some good grip strength there. We're also going to be checking for rooting. So you place your finger over the baby's cheek. They're going to turn their head towards your finger, almost like they're trying to initiate a latch. This is a good sign. And then finally, 2 more. So we're going to have the Babinski reflex. I'll point this way. So on the sole of the baby's foot, you can run your finger along the lateral side on both sides here, and they're going to fan out their toes. If you press on the sole, they're going to kind of clench in their toes. You do that on both sides. And then finally, the stepping reflex. If you hold them over a solid surface, they're going to start kind of dancing or like moving their feet around, or like they're doing like a stepping motion. And if they do all of these, this is all signs of a nice, clean, healthy central nervous system. From here, we're going to talk about some parent teaching. So to make sure that your baby is getting fed enough every day, we want to make sure that we are doing between 8 to 12 breast feeds per day. We're also looking at the baby's overall weight. So when they first are born, they might be looking a little bit heavier. After the first 72 hours, they could lose between 5 and 7% of their body weight. that is completely normal. If it's anything more than that, we want to notify the nurse pediatric practitioner. But yeah, it should be between the 5 and 7% mark. After the 72 hours, they should start gaining weight from that point. When looking at the urine output, it should be 1 wet diaper on day 1, 2 wet diapers on day 2, 3 wet diapers on day 3, then 4 wet diapers on day 4. And then after like a week, you're looking at between 4 and 6 wet diapers per day. For stool, it does go through like a 3-stage process. So it's going to look like meconium first, and it is meconium first. Within the first 24 hours, this is going to be black tarry stool. It's going to be filled with bile, amniotic fluid, other stuff that they're expelling from the womb. And then it goes through a transitional stage. So it's going to look a bit more green, a little bit more discolored. It might have some leftover bile and stuff like that. But then finally, as you do more breastfeeds after like the 2nd or 3rd day, this will look like yellow seedy stools. So it's going to be primarily all that, all the breast milk that they're eating. And similar with the wet diapers, you're going to look at 1 stool on the day 1, 2 stools on day 2, 3 on day 3, and then 4 on day 4. Eventually they kind of sprawl out where you don't really see as many stools every day, but as long as they're continuing to increase in weight, that they're feeding well, between those 8 and 12 feeds per day, then that is completely normal. Now, we are going to talk about things that we should notify the provider about. So if there is any signs of respiratory distress, that is number 1, something that we want to mention to the pediatric nurse practitioner. If there is, if they're not feeding well, that's another one. Always want to make sure that they are feeding really well every day. If they are really lethargic, then that is something that we want to notify the provider about as well. And finally, any signs of fever, straight to the provider on that as well. Now, what I want to do is talk about what if the baby does choke, what to do. So first, if the baby is kind of gagging, then we want to use our bulb syringe. If they're definitely not choking on an object, at least. Usually it's kind of normal for a baby to be gagging a little bit or kind of coughing up. They're getting the excess mucus out, so we want to use the bulb syringe first. So you squeeze in the bulb syringe, you put it in their mouth, and then allow the natural air to fill up into the tube to suck out all that mucus, and then you squeeze it out. You repeat as needed, and then if they are choking on an object, then we do our choking demonstration, which is when you start with the back. You want to hold them in a really stable position and use the palm of your hand, do 5 thrusts, turn them over. You want to use your 2 fingers, do chest thrusts 5 times. If you can see the object in their mouth, then you want to take that out. If not, then you repeat the process, 5 back blows, 5 chest thrusts until the object comes out. As far as safe sleeping guidelines, we always want to make sure that the baby is on their back, alone in the crib. So this is ABC, alone, on their back, in the crib. Want to make sure there's no other objects around them, make sure that they are swaddled and safe, and that they have an adequate amount of clothing on. And then finally, when you are initiating skin to skin with the mother, you want to put the baby or place the baby in the mother's arms upright, and you want to make sure that you are able to visibly see the baby's airways. You want to make sure they're not obstructed, and that the baby is covered as well with a blanket so that they stay warm. And like I said, always making sure we can see the baby's face and their airway and their airway clearance. Finally, that will conclude my assessment on the newborn. Upon leaving, I want to make sure that the baby is safe and warm and intact, properly swaddled and put in their crib. And thank you to the mother, and that'll conclude my assessment. Thank you so much.